Hi everyone, I'm going to keep it nice and short. But basically, we just want to acknowledge that we're actually building up on the work that Avril had done before on the opioid constipation, as well as actually Kim looking at pain management in the medical wards. And we're building on those previous work that we'd done before. Okay. So basically, we wanted to look at uncontrolled pain at the start because we've had the history of working on constipation, as well as we knew from the medical ward audits that there were some degrees of uncontrolled pain and managing that pain if actually pain had occurred. So we really wanted to focus on that and saying, well, if we manage pain well, then hopefully we identify it, we manage that, then also the complications can also be reduced. So we took that kind of broad approach because what's the best way of getting rid of, opioid-related harm? Not use opioids at all, but actually that defeats the purpose of uncontrolled pain not being well managed. And we know from our HQSC patient experience surveys and all those sort of data to help us triangulate to suggest that uncontrolled pain is a priority area for the DHB for us to focus on. So we use this opportunity to I guess, focus on that. And as I said, I've tried to narrow it down so that we don't get too ambitious, and we've said that we're doing it at least Ward 4 for the purpose of this collaborative. But I guess some of that work that we will do is going to inform our e-vitals, for example, that we're looking to implement in the next few years and so forth. So this is some of that undercurrents and teaching to inform us to do that. And to improve the patient experience of pain management. And essentially that's boils down to, if we're talking about pain, it's about what the patient experiences. So how do we improve that as well? So as I said, our scope was within just Ward 4. We've done a few interventions. I guess a lot of it in this first few, these early stages was around the development of the tools. So how do we measure? Do we have robust inpatient management audit tools, for example? Do we have the patient information leaflets and so forth? So developing the inpatient audit surveys and the process of data collection, our patient surveys that we've been developed with our consumer, Judith, and testing it out on a few patients. Standardized local pain management guidelines. So Chrissy, our pain nurse, has worked very hard on this, so trying to develop that and saying, well, if we're talking about pain management, what's the appropriate thing to do? Is there a clear pathway of what we have to do for that? And we're looking at things like new pain scores, pain assessments, and so forth. We've also been, I guess, looking at things like the patient information leaflet. This is, I guess, our traditional sort of approach with the leaflets, and what we're thinking about is, can we turn it into some kind of infographic type, make it like a patient safety card, like an airplane card, and that sort of thing that we can potentially try. So just, I guess, what the data is showing, this is our control chart of our uncontrolled pain, defined as uncontrolled pain equals greater than 2 consecutive scores of greater than 6 out of 10. So very much in line with the Victoria Quality Council of pain management and that sort of thing. So nothing significant. You can see quite a big variation, but I think that comes with this sort of territory with our small numbers and so forth. We have 2 outcome measures, I actually had 3, but this is from the patient experience side of things. So if we're looking at patient surveys, how well do they think that we manage the pain? And that again lines up with the HQSC patient experience survey of, did staff feel, the patients feel that staff did as well as we could to help them to manage their pain. So we're trying to align, not just one measure, but across a sort of national sort of approach as well. This is a radar chart. Basically, across within the patient experience survey, we had asked 16 questions, and across them are the domains of what do we mean by patient experience of pain management. So, for example, you can see here that we generally do quite well, I think, across the board, but where we definitely are not so good at is around side effects, again, consistent with our patient experience survey data, as well as also always obtaining painkillers when needed. That's something that we probably need to work on. So we've got additional data. I'm not going to go into it. You can talk to us if you want later on. But this is around the processes of pain management. So are we monitoring pain regularly? Are we giving regular analgesia? Are we reassessing them if uncontrolled pain gets detected? Are we providing additional analgesia? And we've also looked at constipation and respiration and that sort of data as well. So again, for the brevity, haven't included it. I think, we have a fantastic team. It's been really engaged. It's been tough sometimes. It's a high workload. And I think that's, to work through that, through the not having protected time to do these things, I think it's been a real credit to the team to actually work on all these things that we've achieved. And as I said, resource and protected time is probably the big thing for us. So, yep, very happy. I think that we've had really good commitment and engagement with our staff and our patients. And I think it's been fantastic, getting the surgeons on board, for example. That's might be a bit hard for other DHBs, I don't know, but certainly for us it was a good step in actually getting them to look at medications. So that was a big win for us, and I guess capability, which is the underlying thing that we're all trying to do here. So thank you.